Hi everyone, my name is Nigel Branson. I'm president and co-founder of First Fitness Nutrition. I want to thank you for joining us for this presentation today, where we're going to be discussing the popularity and rise of what is known as the GLP-1 weight loss injections. A lot of you have probably become familiar with the names Ozempic, Wegovy, and Mounjaro. And anytime something becomes popular, there's also an opportunity for people to make knockoffs or generic versions that are not regulated to the extent that a brand name is required to do. So today we're going to be discussing how they work, why the compounded versions have just been banned by the FDA, the implications to the millions of people who are using these injections, and then we're also going to talk about First Fitness Nutrition's Trimsulin, which is the world's first patent-pending plant-based GLP-1 weight loss program. Joining me in this presentation today is our head scientist and product formulator of the Trimsulin weight loss program, Dr. Richard Kaufman. Now, just to give you an overview of First Fitness Nutrition, we are a brand you can trust. We've been in business since 1989. We are a total wellness solution. Our products that we offer fall into the categories of gut health, weight management, wellness, energy and fitness, and skincare. So let's talk about the weight loss craze. I've been in the weight loss industry myself for over 35 years, and I have seen products, science, and research evolve over the last 3 decades, but I don't think anything has captured the attention of the world market as the introduction of these GLP-1 weight loss injections, which are marketed under the brand names of Ozempic, Wegovy, and Mounjaro. And the reason that these injections became popular was because most people are looking for a quick solution to losing weight. Unfortunately, it doesn't work that way. Weight loss is a journey, not a destination. And so for the millions of people that have tried these injections, they have, for the most part, come to a conclusion that this is not a set it and forget it type product. Lasting weight loss success also has to have a lifestyle change. So how did these drugs become so popular? And how do they actually work? Well, your body produces a natural occurring hormone called GLP-1, and that is produced in the gut and then released after eating. And as we get older and as we have bad lifestyle choices, the amount of time that this GLP-1 hormone stays in your body becomes less and less and less. However, if you could increase the GLP-1 naturally, that would then control the signals that says, I'm not hungry, you feel satisfied, and you would have a normal weight. What these drugs do is they are inserting a synthetic chemical into the body that is mimicking what the natural hormone in the body is doing. And unfortunately, it comes with a tremendous cost and a lot of side effects. So how did they become so popular? Well, if we take the manufacturer of Ozempic and Wegovy, a company called Novo Nordisk, they spent over $330 million marketing to the American market in 21 and 22. And round about 2023, the vast majority of Americans watching TV or searching on social media became familiar with just one of the commercials, in this case, Ozempic. And just to show you how desperate people are for a weight loss solution, people only hear what they want to hear, not what they need to hear. Because when you dissect this commercial, which is 60 seconds long, only 24 seconds is about the potential positive benefits of these weight loss injections. And the rest of the commercial is on all the side effects. So, my first question to Dr. Kaufman is, how is it possible, Dr. Kaufman, that a product can penetrate the market to such an extent that it has, yet have all these side effects?
Well, like most synthetic drugs, there are side effects associated with this. Unfortunately, up to 80% of people using the GLP-1 agonists and the GIP agonists drugs that are synthetic receptor agonists experience some side effects. 40% of them experience gastrointestinal effects, and some of them even have life-threatening effects because these drugs are overactivating the receptors to such an extent they're causing other side reactions on a single note throughout the body, producing these side effects. Hence, you get a high discontinuation rate and you get a lot of people having GI upset. However, because they're causing a significant amount of weight loss, people kind of put that on the wayside, even though they're not going to be happy with how their gut feels throughout the day. So it's important to be able to have an alternative using natural secretagogues of GLP-1 and GIP in the gut, and also an enzyme to inhibit called DPP-4 that breaks it down so that you have a natural secretagogue release of GLP-1 consistently throughout the day that in our research has produced up to 243% greater weight loss than semaglutide and 173% greater weight loss than tirzepatide in a similar amount of time. It's also important to note that in the clinical testing of these drugs, all the patients were on a stringent eating plan that they fail to omit to tell you, so that the results that people get may not be the same because they're not following any kind of eating plan.
I think that's a very important point. On the clinical trials of the weight loss injections, the vast majority of people who are in the trials had a BMI of over 30, were on a restricted calorie diet of 2,000 calories a day. And I think what is significant to what you're saying about these side effects is, due to the side effects, the people getting on these injections have to start off on a very low dose. They have to build up to it because of the nausea and the vomiting and the constipation that they get. And to your point of not being able to stay on it, the vast majority of people can't actually benefit from these injections long term because they can't stay on it long term. Can you tell me from your research, what did you find in the form of weight regain from people taking these injections?
Quite simply, most people regain most weight after discontinuation within a year.
Yeah,
And
I
that's
was reading that people gained more than half of the weight that they lost after stopping these injections, which I think is quite horrendous if you think about it.
it's a temporary fix. Knowing you're going to regain when you stop is not incentive when you can't continue. Therefore, in long term, they're failing, and there's a lot of complaints about this.
And this goes back to the point. So we've introduced the weight loss injections. We've basically spoken about how they became popular, what created the craze, and then to add even more momentum to the drugs, regardless of the side effects, you've got these Hollywood celebrities endorsing them. You've got social media, the nationwide advertising. And just to tell you how desperate people really are, Novo Nordisk, the manufacturers of Ozempic and Wegovy, are writing 25,000 new prescriptions every week. Now, this created a worldwide shortage, which then opened the door for something called compounded semaglutide, which is a generic, if you will, a knockoff of the main ingredient in the brand names of Wegovy, and Ozempic. So, Dr. Kaufman, can you please explain to us how compounded semaglutide actually works?
The challenges are that some of the compounded semaglutide and tirzepatides are not even in the same chemical formula as the drug manufacturers are producing. There may be impurities in them and they have a different structural combination that may make them not work the same way. However, they can be sold at a fraction of the cost of what the drugs that are produced by Eli Lilly and Noble are selling, which makes them very attractive to the consumer because rather than having to spend $1,000 a month, they can spend $250 a month. Unfortunately, they still produce the same of side effects, and in many cases, more side effects because there may be impurities and are not the actual compound in reality.
Well, and another thing that you're going to find come out into the news is millions of people could literally call a telehealth company. I mean, you could call up a telehealth company, pay a fee for a consultation, and get a prescription for this, even if you didn't need it. And that created a major problem. I like to say it almost created an opportunity like the Wild West. You didn't know where this compounded formula is even coming from. They were not regulated. There was no reviewing of the manufacturing by the FDA. And this created a tremendous amount of problems in addition to the side effects. There were reports of dosing errors, adverse events, overdoses, incorrect ingredients with the compounded versions. So here is where our talk takes on a very important announcement that I believe the vast majority of people on these injections, especially taking the compounded versions, haven't even become aware of yet. And that is, as of 2 weeks ago, the FDA has now banned the compounded semaglutide and tirzepatide. So semaglutide is the main ingredient in Ozempic and Wegovy, tirzepatide in Mounjaro, and this has been published nationwide. Now, these compounded pharmacies have been given a grace period till May the 22nd. So as of May the 22nd of 2025, they will no longer be able to make a generic version of the semaglutide. So that means that millions of Americans who've been using the compounded versions are going to have two options: switch to the brand names, to Ozempic, Wegovy, and Mounjaro, pay anywhere from $900 to $1,390 a month, or find an alternative. And this is where, Dr. Kaufman, I become very passionate, because I believe that you have created something that is such a world changer in the world of obesity and weight loss. And that is the Trimsulin weight loss program, a very powerful plant-based GLP-1 weight loss program that is patent pending. It controls your appetite, helps regulate the glucose in your body, and creates thermogenic fat burning. So, Dr. Kaufman, I know that you're very passionate about this program and the products in it. Can you tell our listeners today how this program actually works?
Trimsulin program consists of two products, Control and Thermal. Control is your GLP-1 natural secretagogue releasing agent. It causes the body to naturally produce a high amount of GLP-1 and GIP-1 from the gut, and it naturally inhibits the enzyme DPP-4 from breaking them down, so you get a consistent release in line with the natural production of GLP-1, enough to create as strong of actions as the drugs without the side effects. We also combine with that natural thermogenic compounds that work through different signal pathways in the body to create thermogenesis. So the combination of combining the control release of GLP-1, GIP, that's long circulating in the body with thermogenic actions creates a synergy producing up to 243% greater weight loss than semaglutide in the same amount of time and over 175% greater weight loss to tirzepatide in the same amount of time. This is a landmark dietary supplement program, plant-based and natural, without the side effects of the drugs that I can't imagine people not wanting to use for lasting weight loss, including an eating plan, without the side effects of the drugs.
And Dr. Kaufman, can you speak specifically to how you conducted the study?
We took over 500 individuals who had a wide range of BMIs, male and females, and we put them on the Trimsulin program. We monitored their results with the same vehicles of monitoring that the drug companies used in their clinical trials. So we gathered the same data the drug companies gathered on their clinical trials, and then we compared the results to them over the same periods of time. And as you see, we blew away the Trimsulin compared to semaglutide over 3 months and 6 months. This is significant because we using the same methodology and protocols as the drug companies are using on a smaller scale, but we have enough subjects to produce significant results that I stand by in the actual testing of the study that is available for anybody to review.
When you look at the banning of the compounded semaglutide and tirzepatide, the options that millions of people are going to have to make is go and buy the brand names. So in Wegovy, if you're not getting insurance covered for weight loss, which most people don't, now they do get it covered if they have type 2 diabetes, but for weight loss, you're pretty much on your own on that. You're at $1,349. You're taking a synthetic injection and a prescription is required. Manjaro, $1,080 a month, and then there's Ozempic at $997. Or you can look to Trimsulin, a plant-based weight loss program that is an alternative to these costly injections at a fraction of the cost without the severe side effects. And it's a vegan product. So it is safe, it is effective. And so when you take the Trimsulin weight loss program, which is a combination of these two all-natural products, Control and Thermo, and all you do is take this delicious mango-flavored Control drink mix and one Thermo twice a day, 30 to 60 minutes before your meals, you're going to notice a controlling of your cravings, a reduction of your appetite. You're going to notice fat burning, and it's going to support your healthy blood sugar levels. And that is going to give you sustainable, lasting weight loss success. Now, for those of you watching this presentation, the alternative to these weight loss injection is our Trimsulin weight loss program. And a month supply comes with one Control, one Thermo, a healthy eating guide. See, you're going to be actually losing weight, eating healthy food. No counting of calories, no counting of fat grams, no counting of carbs, and it retails for $149 a month. That's about $5 a day. And it comes with a 30-day money-back guarantee. So if you would like to get on Trimsulin and start losing weight, safe, effective, and naturally, I'm going to encourage you to get back to the person that invited you to watch this presentation and say, I want to order Trimsulin today. I want to thank you, Dr. Kaufman, for being my special guest. I'm very excited about the opportunity to help millions of people find their natural weight loss solution that really works. Thank you for joining us, everyone. We'll talk to you soon.